Peace be to you all. Assalamu alaikum. This is Omar Abdul Malik here, physician associate, health educator, and distance athlete. So I wanted to talk to you guys briefly about working in a hospital versus working in an outpatient clinic. So first I'll tell you a bit about myself. I've been in the healthcare field for a little over 30 years. A little over 20 years I've been as a physician assistant, now called physician associate, and health educator. So I've worked in many different capacities. I'll tell you the difference between inpatient versus outpatient can be quite extreme. For example, for inpatients, you may have patients with multiple morbidities, but they've had decompensation of those morbidities. For example, if they've got type 2 diabetes mellitus, they now may be on dialysis 3 days a week, so they're getting dialysis in the hospital. If they've had a coronary artery disease, maybe they had maybe their status post-surgery, like a CABG, coronary artery arterial bypass graft. Maybe they've had a heart attack or a triple. They've had a abdominal aortic aneurysm repair, so they're in the hospital, getting therapy, whether it's physical therapy, occupational therapy, wound care therapy, especially if they've been in a car accident or in the area that I work, which is Washington, D.C. Some parts of it are quite violent, so we've got a lot of patients, unfortunately, who are multiple gunshot wound victims, and they are in hospital getting fixed, so getting their wounds tended to. They've been discharged from the emergency department or the ICU and are brought to a hospitalist, where the hospitalist PAs like myself or nurse practitioners or MDs see them kind of manage their care. It's because that person's primary care provider may not have privileges at the hospital where the patient is. Outpatient is a bit different. Outpatient, you may have patients with multiple morbidities, but they have not suffered severe decompensation. So I may see patients who've got type 2 diabetes mellitus, obesity, metabolic syndromes. That's a combination of lipid disorders, so high cholesterol and hypertension, diabetes that's poorly controlled. So they just need a lot of patient education and kind of management of their different morbidities. So you do things like do a physical exam, again, health education, filling prescriptions, maybe giving that person a referral to different clinics, especially if it's a wellness visit. So a woman exam. So if they're 40 or over, maybe you give them a referral for a mammogram, or maybe send them to OBGYN to get their pap smear. If it's a man over 40, you may need a digital rectal exam or a colonoscopy if he's over 50. So a lot of kind of wellness-oriented work. And I would say the different positions require a different approach. So if you are taking care of patients who are in hospital, a lot of those folks they've already come in diagnosed with things. So you'll get a patient packet that's got all of their diagnoses, and then you as the hospitalist would kind of address those diagnoses and make sure that they're getting the medications that they need, and then doing things like having phlebotomy, draw labs on them, and things like CBC, so your complete blood cell count, your complete blood count, BNP, basic metabolic, to look at things like their renal labs, their electrolytes, and their LFTs, so liver function tests, possibly thyroid tests, and then just making sure that they're on the right amount of medications that they may need, or correcting for any electrolytic imbalances. You're not going to be doing that so much as working with outpatients. So with outpatients, You may order the labs, but then have the patient come in for like maybe 2 weeks later. Or if it's just a wellness visit, maybe the person's got comorbidities of let's say HIV and diabetes, type 2 diabetes and hypertension. So you'd want to have them come back in, for maybe a viral HIV viral load and a CD4 count for the HIV. Have them come back in to check, make sure that their blood sugars, glucose levels are within controlled limits. So one of the things that I like to do is I like to have patients, for outpatient, is I like to have patients bring their medications to their clinic visit, because sometimes I've had a lot of patients borrow the medications of their friends. They'll have this big bag of medications. They're like, oh, that's my water pill, that's my sugar pill, and this is a pill that I borrowed from my friend for when I'm in pain. So you got to kind of sort out what medications people are taking and say, well, this medication is expired. Don't take your friend's medication. You don't need this medication anymore. Sometimes you've got people kind of making their own cocktails up for their medications. They'll add things, kind of natural cures. I had patients taking St. John's wort. And for those of you guys that may know, St. John's wort is a very potent inhibitor of the P450 enzyme. This is found in the liver. A lot of medications are processed through the liver. So if you're taking medications and St. John's wort, so a natural medication that you think is helping you at the same time, it may block the efficacy of that medication. So I see this, from time to time in the outpatient, never in the hospitalized patients, because they already have pretty much a set of prescriptions that they've already been prescribed and they come in with, and those medications are dispensed by pharmacy. And I'll do a little bit more talk on that. Oh, let me talk about this. Maybe the pay difference between working in a hospital versus outpatient clinic. So if you're doing outpatient clinic, in particular as a PA, your pay may be a little bit on the low side if you're just working in a regular quote unquote internal medicine or family practice office. You know, doctors tend to be, who are family practitioners or internal medicine, tend to be on the low end of the pay. I think they make their salaries about $220 per year cumulative. So as a PA, you can expect to make on the lower end maybe $60 an hour. So I think that comes to about $115,000 a year. In some cases, maybe $120 if you do some procedures that you can do in-house. I don't know, maybe I&D kind of things, incision and drainage, maybe pap smears if it's internal medicine or family medicine practice. You can charge for that instead of sending them to OBGYN. If you're a hospitalist PA, you may make a little bit more. You can make as much as $130 to, in some cases, $160 or $170 even. If there's things like bonuses and you get into doing a lot of procedures. So it really depends on what the practice is like if you're doing outpatient, and then what the practice is like if it's an inpatient hospitalist group. But that's it for now. If you guys have any more questions, please leave your comments in the questions in the comment section. If you are interested in becoming a PA, please feel free to reach out to me. I'll reach out to you. I'm available for a consultation if you want me to look at your personal statement. I just need some advice. I've been a PA for a long time. It's a lot of fun. I would have left it a long time ago if I didn't enjoy it. All right, guys, I wish you guys the best of success in your positive endeavors. For those of you guys who are observing the CM or the fast of Ramadan Mubarak. Take care. Peace.